Hello there! Hello nurses and hello world! I am Nurse Giselle and welcome back to my channel. This video is solely for demonstration purposes only, as interpreted by the actor based on her understanding of the specific skill with reference to the Royal Marsden 10th edition. All information presented are public domain materials accessible to the relevant governing organization's website. Subtle similitude may be noticeable, however, this is not intended to be definitive guide to the NMC Part 2 Test of Competence or the OSCE examination. This can be helpful materials for overseas nurses or internationally educated nurses to learn and adapt to the UK clinical setting and transition effectively into practice. And yes, today I'm going to show you another API, okay? Let's start with assessment. This video is all about assessment. But what assessment am I going to do? Let's see. Shall we do pneumonia or subdural hematoma? Which one? I'll give you 10 seconds. You choose. It has been decided, we're gonna do subdural hematoma. What is subdural hematoma? A subdural hematoma is a serious condition where blood collects between the skull and the surface of the brain. It's usually caused by a head injury. Symptoms of subdural hematoma can include a headache that keeps getting worse, feeling and being sick, confusion, personality changes such as being unusually aggressive or having rapid mood swings, feeling drowsy, and loss of consciousness. Candidates, remember that you only have 20 minutes to finish this station. Candidates, you have to always verbalize what you are doing. You also need to complete the neurological observations. Perform an A to E assessment in a systematic way. Perform a full ID check and do not dismiss the patient's complaints or concerns. Overall, you need to make sure that you have a complete and accurate documentation. Before starting the procedure, candidates always remember to read the scenario carefully. Before starting the procedure, I'm gonna wash my hands using the steps of hand washing in accordance to the World Health Organization. First, wet your hands. Obtain some soap. 5 backwards and forward stroke from palm to palm. Right palm over the left dorsum and vice versa. Fingers interlaced. Fingers interlocked. Rotational rubbing of the thumb and vice versa. Rotational rubbing of the palm with finger clasp. Rotational rubbing of the wrist. Now rinse it thoroughly with water. Pat it dry with clean towels and dispose it in the domestic bin. Approaching now the patient, making sure that the scene is safe, and provide privacy and dignity for my patient by closing the windows, the door, or the curtain. Hi!
Hello.
Hi, I'm Nurse Giselle and I'm going to be your nurse for today.
Okay.
I am here to do an assessment. So basically, I'm gonna check your blood pressure, pulse rate, and the likes, if that's alright with you. So would it be okay if I just do an identification check?
Okay.
Okay, so before that, Let me just check your file. Okay, so let me just gel my hands. And let it dry for 30 seconds. Would it be okay if I just have a look at your red wristband, if that's alright?
Yeah.
Okay, can you please tell me your full name, please?
Marina Winters.
Marina Winters. I need to compare it with my prescription. Okay, Marina Winters, and your date of birth?
1st of December 1967.
Okay, 1st of December 1967, and your hospital number is MW12345678890. MW12345678890. I can see that you're wearing a red wristband. Are you allergic to any food, medication, or latex?
I'm allergic to penicillin.
Penicillin, okay. What kind of allergic reaction you get from
I
that?
got rashes.
Rashes. Don't worry, I'm not gonna give you any penicillin derivative, okay? Thank you very much. Gel my hands again and let it dry for 30 seconds. What do you want me to call you, by the way?
Just call me Marina.
Marina, okay. As mentioned a while ago, I am here to do your assessment, in which I need to do your observation, including your blood pressure, pulse rate, and the likes, okay? Are you comfortable sitting there? Do you want to get back to bed?
I'm okay at the moment.
Okay. Do you have any pain at all?
Oh yes, I had a fall.
You had a fall?
Yes. I hit my head. I landed on my left hip and left arm. That's why I got bruises.
So sorry to hear that. Can you rate the pain from 0 to 10? 0 being no pain and 10 being the worst?
Around 7?
7 out of 10.
7 out of 10.
Oh, I'm so sorry to hear that. Did you had some analgesia already?
Yes, I had 30 minutes ago.
Okay. So are you still in pain? Do you want me to give you more, or you want to wait for the medication to take effect? Because normally it takes 30 minutes to 1 hour to take effect.
Just wait for it.
Okay. So are you happy for me to still proceed?
Yeah.
Okay. Okay, I can see that you have your hearing aid right here, Marina. Do you want to wear it before we start?
Yes, please.
Okay, here you go. And I can see that it's already been labeled, so I'm just going to put it here in case you need it. You alright?
Yeah.
Yeah, okay. I'm going to start now the A to E assessment, and later on I'll be asking you a few questions if that's alright with you.
Okay.
Okay, let me just gel my hands. And let it dry for 30 seconds. Okay, let me just start with your airway, and I can see that you're talking to me, responding to my question, and I can see no visual obstruction. All right. For breathing, I'm gonna need to assess your oxygen saturation, if that's all right.
Okay.
So, Miss Examiner, is this machine clean and ready for use?
Yes, it is.
Okay. So would it be okay if I just put this device? This is a pulse oximeter. I'm gonna put it in one of your finger. Which finger do you want me to put it with?
Index.
Okay, thank you very much. I can see that there is no nail varnish. Okay, your oxygen saturation is 97% on air. There is no respiratory noises such as rattle, wheezes, stridor, and coughing. There is no visual signs of respiratory distress such as the use of accessory muscle. There is no sweating, there is no seesaw breathing, and there is no cyanosis, which is good. Okay, now I need to check your pulse rate, if that's alright with you. I need to check it for a full 2 minutes, if that's alright. So which hand do you want me to use? At this point, I have to wait for 1 full minute to count the patient's pulse rate. And then after doing that, I need to wait again for another 1 full minute to assess her respiration. Okay? So overall, I need to do this one for the full 2 minutes. 1 minute for pulse rate and 1 full minute for respiratory rate. Assuming that it has been 2 minutes already, thank you very much. So what I have done is I have checked your respiratory rate first before I've checked your pulse rate. I did not tell you about it because that would sometimes alter your breathing, okay? Your respiratory rate is 20 breaths per minute, which is the depth and the rhythm are regular and normal, whilst your pulse rate is 77 beats per minute. The rhythm and the strength are normal, okay? or the values, you can document it on this page, or you can directly document it in the neurological observation chart. Now, as part of the circulation, I need to check your blood pressure, okay? Miss Examiner, again, is this machine clean and ready for use?
Yes, it is.
Okay, for this one, I need to put this cuff around your arm. It's gonna tighten a little bit, but it's not gonna take too long, okay? Which arm do you want me to use?
You can use my right arm.
Oh, okay. Okay, you said you want it to be done on your right arm, yeah? Would it be okay if I have a look at it?
Yeah.
Okay, I can see that there is no sign of infection, inflammation, rashes, and there... have you got any wound or any... Have you been operated on that side?
No.
How about on your right chest?
No.
Okay. Okay, your blood pressure is 120/87. Make sure that after the procedure, you have to clean the machines that you have used, okay? Okay, I just need to also check your capillary refill, if that's alright. May I? Okay. I can see there is no nail varnish in here. 1, 2, 3, 4, 5, 1, 2. Okay, your capillary refill is less than 2 seconds, okay? Now I need to check for pallor and perfusion. Yeah, okay. You are warm to touch, and I can see that there's good perfusion. Once again, nurses, I just wanted to remind you, you can document it here on this page, or you can directly document the findings or the values in the GCS chart or the neurological observation chart. It's for you to save time as well. Let's now do disability. So, Marina, do you know where you are right now?
Am I at home?
Actually, at the moment, you are now in the hospital. You were brought here early this morning because you had a fall, okay?
Okay.
Do you know what time it is?
Is it nighttime?
It's now 8 in the morning, Marina.
Oh, okay.
Don't worry, I will keep reminding you. Do you know who am I? Yes, I'm your nurse for today, okay? That's why I'm doing this observation and I'm doing this assessment, okay? Don't worry, I will be here to reorient you regarding the time, the place, and the person and the people here, okay? Don't worry about it, okay? It is apparent that the patient is slightly confused at the moment, okay? As part of the GCS, this is the time now that I'm gonna do the GCS chart, the Glasgow Coma Scale. So I can see that you're spontaneously opening your eyes and closing your eyes, which is good. And you are slightly confused with the time, the place, and the person that it's here. So the patient is slightly confused. Let us check for the motor response. Okay. Are you able to just raise both of your arms?
Yeah.
Okay. Raise it up to here. I can see that there is an apparent weakness on the left side. Please. Can you squeeze my palm? Yeah, okay. I can see that there is an apparent weakness on the left side of the patient. Can we do that on both of your legs, okay? Okay, can you raise both of your legs? Okay. Can you push it against my hand? Okay, thank you, thank you. So I can see that the patient is having weakness on the left limbs. I also need to check your pupil reaction, okay? I'm gonna flash a light on your eyes and I need you to stay still, okay?
Alright.
Would you be able to just remove your eyeglasses, please? Thank you. So I'm gonna need you to look at my lower ear, okay? While I'll flash the light on you. Would it be okay if I just cover your eye as well? Do you want me to cover it or do you want to do it yourself?
I can do it.
Okay, so if you could just cover one of your eye. The other one, please. Okay. So, the patient's pupils are equally reacting to light. So, a while ago, you said that you are in pain, which is at the back of the head, and
Yes.
your left arm and your left hip is still the same case?
Yes. Yes, it's still 7 out of 10.
Okay, and how about your urine output? Have you had a wee already?
Yes, I did a while ago.
Was it a good amount?
Good amount.
Do you have any problems at all in there? No? How about your bowels? Do you have any problem?
I have no problem with my bowels.
Okay, so that's good. Okay, how about your blood sugar? Has anyone checked your blood sugar yet?
I'm not sure. I don't remember.
Okay, has anybody have pricked one of your fingers to check your blood glucose level?
I think someone did.
Okay, don't worry. I will check your records. If none of them check, then I will check your blood glucose level. Are you diabetic?
No.
Okay, that's even better. Okay?
Once again, candidate, just a reminder, you can document it on this page or you can directly document the findings into the GCS chart or the neurological observation chart. It will again save your time.
So let's now do your exposure. Miss Examiner, is this thermometer clean and ready to use?
Yes, it is.
Okay, I'm gonna check now your temperature by using this device, which I'm gonna place near your forehead, but I'm gonna need you to stay still, okay?
Okay.
Alright. I can see that the forehead is clear, there's no sweatiness in there. So your temperature is 36.4 degrees Celsius, which is normal.
Verbalize that you're gonna clean this machine after use.
Alright, you said a while ago that you bumped your head and you also landed on your left hip and your left arm. That's why it's a bit bruised. Do you have any other bruises aside from that?
No.
Any bleeding at all?
No.
Rashes around your body?
No.
Okay. So, I can see here, this is your record. I can see that you got a past medical history here. You've got history of multiple falls since 2 years ago. Yeah? You remember that?
Yeah.
And you had a right neck of femur fracture a year ago.
Yeah.
Okay. And you also have a hypertension.
I think I'm taking medication for that. I think, yeah.
Don't worry, I'll have a look at your record. Don't worry about it, okay? Okay, thank you very much.
Again, just a reminder, you can write it here or you can directly document it in the neurological observation chart or the GCS chart.
So I've just finished the observation. Just need to record that one and document here in your neurological observation chart. Would it be okay if I do that?
Yeah.
Yeah, okay. Thank you very much. Are you comfortable there?
Yes, I am.
Okay, let me just document.
Documentation is vital on your assessment. So it's either you document now if you hadn't got a chance to do so a while ago, or you can document as you go along assessing your ABCDE as shown prior in the video. It will save you a lot of time, but like I said, if you have practiced this multiple times, it would be easier for you to know how long are you gonna write, when are you gonna write each section or all together. So it's all up to you in your own discretion. Now I am documenting the blood pressure. Make sure you put your arrow there, and it's good to put the values as well so you can be able to remember it. 77 was the pulse rate. Respiration, it was 20. Now I get to see the pupil reaction. Okay? So positive if there's a reaction, negative is if there's no reaction. See if the eye is closed. Going to your limbs, you can put it there because the right hand have a normal power. However, the left leg and arm got mild weakness. Now we're gonna total the GCS score. 4 for the eye opening. I got here 4 again for verbal response. I have noted 6 for motor response. So I get a total of 14 out of 15. So now that's our total GCS score. Now I get to write my initial as well. So that's how you document this. So this is how easy documenting in your neurological observation chart or GCS chart.
Okay, I am now finished with my documentation. Let me just jab my hands. Your airway is clear. There's no visual obstruction. When it comes to breathing, your respiratory rate is normal with regular rhythm and normal depth. Oxygen saturation is also normal. When it comes to circulation, your pulse rate is also in the normal side, including which is having regular rhythm and strength. Your blood pressure is also normal. Capillary refill is less than 2 seconds, which is also normal, with normal perfusion and no pallor noted. Okay. Disability wise, you are slightly confused at the moment. Your eye opening is spontaneous, which is okay. However, there is a slight confusion in here, so I just need to keep observing you. Motor as well. You are obeying commands. However, your limbs, your upper and lower left limbs, which is your left arm and your left leg, is having mild weakness. Okay, so like I said, I need to keep an eye on that. Your pupils is equally reacting to light. You've got normal urine output, no issues with your bowels as well, and I need to check your BM at the same time. Okay, when it comes to pain, you've got 7 out of 10 at the back of your head with your left arm and your left hip, which in exposure they're all bruised as well. Temperature is also in the normal side with your past medical history already discussed. Okay, so those are your A to E.
Because your GCS score is 14 out of 15, I have to monitor you every 15 minutes for the first hour, every 30 minutes for the next 2 hours, and hourly for the next 4 hours until stable. And I also have to escalate the findings to the doctor for further management. Okay?
So now, would it be okay if I just ask you a few more questions? Okay. So I need to ask regarding your ADLs or activities of daily living. So maintaining your safe environment, we already established where you are right now. So I just need to make sure that you're reorientated with the time, place, and the person who's gonna be caring for you in here. Okay. If you have any question with that, please do approach us or please ring your bell. It's just right here. I'm going to put it here. If you have any question, please do ring the bell, okay? So make sure that everything is within your reach. Call bell, your hearing aids. Yeah, like I said, if you need help, you need to make sure to call us for assistance, okay? So that you don't have another fall, okay? Yeah. So and if you want to go back to the bed now, please ring your bell or give us a shout because we need to help you, making sure it's safe for you to be transferred to the bed already, okay? Making sure that you won't have another fall. Call and don't fall, alright? In maintaining safe environment, need to make sure that your environment is safe, including the light. Yeah, is the lighting okay for you? And you are a bit near to the nurse's station because we need to keep an eye on you as well, okay? Also, is the temperature okay here? Yeah, okay. So if you need anything again, the call bell, alright? The next one is the psychosocial part. Do you live with anyone at home?
No, I live alone.
You live alone?
Yeah.
How about, are you married?
No, my husband died already.
Oh, I'm so sorry to hear that. So no one is there in your house?
No.
Any relatives at all?
No. But nurse, I'm worried about Snowflake.
Snowflake? Who is Snowflakes?
My cat.
Your cat. You're worried about your cat.
Yeah.
Where is your cat at the moment?
She's at home.
Do you have someone who can take care of Snowflakes?
I have my niece who lives 2 blocks away.
What's her name?
Autumn.
Don't worry, we will contact her to keep an eye on your cat, Snowflakes. And if she's not responding, then we could ask a social worker to drop by in your house and take care of your cat, okay?
Okay, nurse.
Okay, so don't worry about it. And lastly, I got here mobility. So, how do you walk about at home before you had a fall?
I am walking independently actually, but sometimes I use my stick.
Your stick?
Yeah.
Is that the stick that you...
Yes.
Okay.
Yeah. But most of the time, I'm independently walking.
Okay. So, what do you need the stick for?
Just if I'm really tired, I use my stick.
Oh, okay. So we really need to reassess your mobility. Don't worry, I will refer you to the physiotherapist, making sure that we again assess your mobility to give you the proper walking aids, okay? You need to have your appropriate walking aids, okay? If you need so, okay? Would it be okay if I just remove the stick there?
Yeah, it's alright.
Because we really need to reassess you first, and then we'll determine what walking aids you need, if you need it, okay? Okay, and you also have a left-sided weakness, so we really need to make sure we know what we need to use, okay? But at the moment, I will label it, I will put it aside. If you need it, if the physiotherapist recommend that you need to use that one, then I'll give it back to you, okay?
Okay.
Thank you very much for that. So we are now done with the assessment. I have documented everything. So aside from the concern about snowflakes, do you have any other concerns?
No more.
Okay. Are you comfortable in there? Because I'm gonna go now. However, if you need us anything at all, here's the call bell. Please ring us, okay? Or just give us a shout. We're just outside, okay? Thank you very much for today. I will be coming back after 15 minutes again to reassess and of course your pain relief, okay? Thank you very much. I'm just gonna gel my hands. Let it dry for 30 seconds. So for the equipment that I've used for the whole procedure, I will need to clean it. And then after procedure, I will wash my hands using the steps of hand washing. So how do you find it? Is it good? Is it what you expected? Okay, so that's the end of the assessment when it comes to subdural hematoma. Watch out for the subdural hematoma planning, implementation, and evaluation. So if you like this video, give this video a like and subscribe to my channel. Also, if you want to get notified just in case I post more OSCE videos, then hit the notification bell. And yeah, if you want to ask me any question at all, please do hit the join button. So all your question will be pop up to the top and I'll be able to see and read it and reply you as soon as I can. Like I said, as soon as I can, okay? Thank you very much for your support. We are now on the road for our 10K subscribers. Don't forget to give this video a like and subscribe to my channel. Again, thank you very much and see you on the next one. Bye! Alright, nurses, time for our shout out for today. The first shout out goes to Angel Superstar 3652. Congratulations! Next shout out goes to Uluwatoyo Silucian 496. Again, congratulations! And once again, another congratulations to ZZ19I5. Congratulations! Lastly, I want to give a shout out to Lito Troy. Good luck on your OSCE exam.